Welcome back to Let's Learn. I'm Kelly Hart along with Jessica Arroyo from Health Alliance and from Confluence Health. We have Shannon Sims here with us, and we're trying to help you cut through some of the confusion that could become senior health insurance for you. The difference between Medicare and the Medicare Advantage plan that Health Alliance offers. One thing that occurred to me was, okay, so I've been a Medicare client for a number of years, and I want to make the switch. How hard is it to switch from one provider to the next provider? And do your plan years only run from the first of the year to the end of the year? That's why there's an election period that ends on the 15th of December.
Right, so the switch is not hard at all. Actually, our members come in, fill out their application, and they're like, well, it's not as hard as I thought it was going to be. So you have multiple options. You can come into our local office, fill out the application. We get that sent off to our enrollment department, mail in your application, or you can, or two other options, you can do it over the phone, or you can do it online. So at healthalliancemedicare.org.
Okay. The conversion piece, I filled out all my paperwork, sent it in, whichever method I choose to do it. Then I sit and wait for a phone call or an email or a piece of mail, and you're sending me my, hey, you're enrolled now, kid.
Within 10 business days, you do get a welcome letter saying, thank you for enrolling Health Alliance. Your plan will begin January 1st.
Okay. And do I get an ID card?
Yes, that ID card gets mailed out mid-December.
Okay. So then when I go to my medical provider, whichever one's covered in my network here, I just take that card with me the first time and go.
Yes, so all you would have to present with that card is when you go see your doctor and when you go to the pharmacy. And the neat thing about Health Alliance is you don't have to carry your Medicare card around with you. It does have a lot of personal information on there, so you can put that away in a safe place, and all you have to carry is your Health Alliance card.
Okay, cool. And that first time is all you got to present your card usually, right?
Usually, yes.
Because they'll get you into the system, and once you're in the system, everybody can pull you up.
Yes, that's correct.
Got it. So when people are electing to go with, for example, your plan, what do they need to think about when deciding to go off of Medicare and going to you? What things pop up to them most commonly?
The most common is their providers. They want to make sure that they've been seeing their providers for so many years, and they don't want to make the switch. They trust their provider. So that's one of the main questions. Do you cover my primary care doctor, and do you cover my specialist? More than likely, if they're here in town, we do. And if we don't, again, it might not be the plan. The other most popular is the prescription portion, to make sure that we do cover their medications. They've been on it for 10 plus years.
Is it fair to ask, how good is your prescription service? I mean, am I looking at reducing the costs of my prescription drugs if I go with your plan?
You are. So you have set copays with your prescriptions, and we do have a formulary that we look up your prescriptions to make sure that they are covered. Our pharmacy department works great with us. If we can't find something, they give us alternatives, and then our members will discuss that with their doctors to make sure if making a switch would be appropriate for them.
Now, when you say our pharmacies, for example, I use a specific pharmacy in town. Is that what you're referring to?
Yes, and
so they're your partners in this too.
They are. Okay. So we have contracts with pharmacies as well. So we do have a special amount that you pay just for being a Health Alliance member.
Got it.
Yeah, there's additional discounts for being a Health Alliance member.
Oh, cool.
And another really great component of the pharmacy is with our local customer service office. I don't know, have you heard about the donut hole or the prescription drug coverage gap a little bit?
Yep.
Okay.
Yep.
So we have some members who are on very expensive medications because of their health condition, and we will help them with if they're getting ready to come to that donut hole level where their out-of-pocket costs will rise. We are there at least to help provide a service of when that might happen for them so they can financially prepare, or also maybe help them with some programs that might save them money and keep them from falling in that gap.
Have heard of that that gap piece that's there. Have a couple of elderly parents and in-laws that currently have to deal with things like that. And of course, at our younger age, we don't think of that. We don't have that necessarily that problem. But you're talking about people that have dozens of prescriptions, not 2 or 3.
Right. One of the main things that we hear are people cutting their prescriptions, like their pills in half to spread them. Or if you're a diabetic, perhaps when you hit the coverage gap, stopping your insulin, which is. So we actually have a health coach that'll reach out to those members and just help them overcome those barriers and work through that so that they are staying current with their medications to help their chronic condition. It's very important.
When a client comes into you and they start asking you these kind of questions, those are the specific answers you can give them?
Yes.
For example, I would come to you and say, the current plan I've got doesn't, it covers this, but it doesn't really cover that. For example, a plan that I've been on didn't cover testing supplies for diabetics. But other plans do cover testing supplies for diabetics. So can you break it down that specifically for a client?
We can even break it down to what brand we cover, what type of strips you should use. If we need to make a phone call, we do that on behalf of a member here. So that's the neat thing also about having our local office, that we fight for our members and act on behalf of them.
Are you hooked up with every pharmacy? Or are there some that just aren't in the plan?
I think all of them here in town are contracted with Health Alliance.
And within your region too as well, right?
Yes.
Okay. Very cool. We talked about prescription drugs, but as far as coverage and cost is concerned, if I go to my pharmacy, they already have a plan where certain drugs for me are $4, $5, and other drugs for me are maybe $15, which is even below what my insurance piece is. Does the insurance piece work with the pharmacies to make sure that you always get the lowest price? Is that how that works?
Yes, so let's say you have a medication and it's lower than our set copay, you're always going to pay the lesser amount. So that's, you're always going to be getting the best deal just by presenting your Health Alliance
Okay,
card.
so we're not stuck with the copay level you have,
No.
have assigned. You're perfectly good with the pharmacy giving us a better discount. Okay, cool. I think that's really important for a lot of seniors because I think they shop at certain pharmacies.
Right.
Even some of them will get some of their drugs from this pharmacy because they get this deal on it, and some of their drugs from this pharmacy because they get another deal on those there. Okay, and you encourage that from them. You encourage them to not just rely on what your plan says, but to look around and to shop. And
Correct, and we do actually make that offer when they fall into the coverage gap because they're paying a percentage of their medications, and every pharmacy has their own price. So we do encourage them to call around and say, hey, how much does this medication cost me? And then go to maybe the next pharmacy, it's cheaper for them. So they do make that change during that time just to save money. So, and we're perfectly fine with that.
Now, Confluence has its own pharmacy as well. And you guys are completely in line with what the Health Alliance plan part of this is, right?
Yes.
Cool.
Very much so.
That's very cool.
Yes.
We're going to take another break, and when we come back, we'll wrap up with this segment of Let's Learn on the NCW Life Channel.